Well, we're privileged to have Dinah LaCaze with us today from the Milwaukee County ADRC office, Department of Health and Human Services. Dinah's presentation is titled Abuse in Later Life, Detection, Reporting, and Victim Advocacy. Dinah is the Adult Protective Services Prevention Program Coordinator, Chapter 55 for Milwaukee County Aging and Disability Services, where she works in the APS Unit. She coordinates emergency protective placements for older adults and provides education and training on adult protective services and dementia. Dinah graduated from the UW Milwaukee with a degree in social work, has her APSW and a certificate in trauma counseling. Dinah, thanks a million for joining us today and offering us your expertise. We really appreciate it.
Thank you so much for having me. I appreciate everybody being here to listen to me talk about abuse in later life. I certainly am not the expert. And thank you, Beth, Monica, and Teresa for all the work you're doing over there in Dane County. That is very wonderful and leaves us with a lot of hope on where we're going forward with dementia redesign. So can you all see my screen? I can't see you after I put the screen up, so I hope it works.
There, it's much better, Dinah. I see it, and
okay,
it's clear now. Go ahead.
All right. So again, I work for Milwaukee County Department of Health and Human Services. This year in January, we integrated our services. We were previously the only county in Wisconsin that had an elder abuse unit and adult protective services. So we felt like we really needed to get in line with the rest of the state. And now we're just aging and disability services, adult protective services. And I trip over that quite frequently because I'm still getting used to it. I think I must have said elder abuse and adult protective service at least 250 times. And now I've only said this probably about 10. But in any event, hopefully I can give you some good stories and present this to you today that helps you understand the importance of prevention when it comes to elder abuse. Some of the objectives we have for this presentation is to provide information about elder abuse and possible signs of abuse, provide information about how and where to make an elder abuse referral, to provide an understanding of the role of adult protective services in responding to concerns of abuse, neglect, and financial exploitation in the community, and to provide an overview of the current initiatives in Milwaukee and Waukesha counties that are working to improve the provision of services to the most vulnerable adults in our community. So I think Beth indicated earlier that she and her team in Dane County play a role in our state dementia redesign. Both Lori Kohler and myself co-chair the crisis work group that Beth referred to. And part of our objectives is to look at education and training, to have consistent education and training for people with dementia and crisis, and to look at what the legislation, how our Chapter 55 emergency protective placement and services statutes plays a role in dementia crisis. That's a very brief overview of our role with that. So what is adult protective services? Who we are and who we serve. Adult protective services is statutorily defined in Wisconsin. We have two statutes, our Chapter 55 statute, which is our adult protective or our protective services and placement statute. It governs not only emergency protective placement, but it's the primary statute that adult protective services works under because it defines our response for adults 18 to 59 and over 60. There's a sub-statute called 4690, which just looks at the age of the person. And that magic age is 60 years. But again, anybody that imagine some exciting things in Wisconsin have happened in the past couple of years where our legal statutes for people 60 and over have become more in line with our statute 4690 to get legal help for people 60 and older. Every county in Wisconsin has an adult protective services unit. And we have a statewide elder abuse reporting line that works to help the counties get those reports down to the people who respond in the individual counties. So what is abuse in later life? 1 in 10 Americans age 60 plus experience abuse. It truly is the elephant in the room. 1 in 10, that's huge. Without decent healthcare, public resources, the population just becomes more risky as we age. Now, you could simply say that the age 60 means next to nothing because the new 60 or 60 is the new 40, right? I'm almost 60 years old, so I get it. I don't want to be determined to be older, but reality is medical conditions affect people 60 and older differently. Physical changes, loss of necessarily have the social supports if they lose a loved one or they're estranged for their family or they have ongoing mental health issues. They're more vulnerable as they age, period. Elder abuse creates health care and legal costs that are often carried by public programs such as our managed care organizations, Medicaid, to a certain extent, Medicare. When a person loses their whole income in a flash because someone milks them out of it, then they're going to be on a Medicaid program to get the care and services they need, and that affects everyone. Annual $7 annually Medicaid program. Just in the last 2 weeks, I've had over $1 million worth of financial exploitation cases on my desk. But I have a lady who met a friend at church, and she convinced her out of a $160,000 loan to help her husband who has dementia and her son who has Down syndrome. And the lady was an accountant, so she kept fairly meticulous records. However, during an interview with her, she's repeating the same things over. And I said, well, when was the last time you ever gave her money? And she said, oh, I have it all written down here. She had a separate spreadsheet that she had it written down on, and she couldn't find it because she put it in a different place. She has some early cognitive impairments. And why is that significantly important is because people in that mild cognitive impairment area can be coerced or manipulated out of money. And the statute specifically has protections in it for them. So defining elder abuse, I kind of alluded to this, that elder abuse is defined under statute 4690. It defines what is physical abuse, emotional and verbal abuse, sexual abuse, or unreasonable confinement or restraint, financial exploitation, caregiver neglect, or self-neglect. Okay, 1 in 10 adults, again, over age 60, are abused, neglected, or financially exploited. That's a huge number. So what are the risk factors for elder abuse? Social isolation, cognitive decline. Sorry, thought I turned it off. Gender, women are more likely to be victims than men, but don't discount the men because they're not going to tell us. They're not going to tell us that they are a victim of abuse, whether it's domestic abuse, financial exploitation, or neglect. There are also typically underlying issues of trauma. There's a high prevalence of domestic abuse because our domestic abuse laws are not very narrow like other states. Our domestic abuse laws include people living in the household that can potentially be involved. And I say this to you because I've been participating in the abuse in later life training that Mike Austin has wrote the grant for with the Department of Justice. And as part of that training, we get trained to be facilitators of the training for police officers and direct service professionals. And I stood up in front of the room after being trained and thought to myself, wow, every example I have to give everyone here today can fall under this domestic abuse statute. because they live in the household. How many times in our world of social services, whether we do caregiving as a CNA, or we are in a hospital social work position, or we're interacting with other social workers, do we hear about the family member living with the elder or adult at risk, and they're blocking services, or they're not allowing services, or they're not doing what they're supposed to be doing, but they're living on this person's dime. So, and then they shove them, or they hit them, or they withhold their medication, or other situations that go on. There's a high prevalence of mental health and substance abuse issues. They use all the money to buy alcohol for themselves, and they've always lived with mom or dad, and mom and dad has always supported them. Sometimes we need to look at where we can help best. Do they have physical or medical care issues? In the past few years, I've had very few cases where a person had not had any medical care for 20 plus years. Most of the people are going to the emergency room or seeing a doctor frequently. But whenever someone comes across my desk that hasn't had any medical care in 10, 15, 20 years, that's significant, because what is really going on with that person? Are we ruling out all of the medical complications that could be going on for a person over the age of 60? Sometimes caregivers with limited support or underlying personal concerns, their own past trauma or mental health. That's frequent. You know, the son or daughter that has significant mental health issues. I once had a case a couple years ago, probably maybe 5 or 6 years ago, and we thought APS solved the case, right? We had a family member isolating an elder who was in her late 90s. She was like 98 years old. She had she was in the last stages of dementia. And she was, when we first got the case, she was fairly ambulatory. She could still talk, but she wasn't getting up as much, right? And then the daughter happened to be a medical doctor. And the son, the other children, there was a couple other children, 3 or 4 other children, and they all had like very advanced degrees. One was an attorney, one was a financial accountant, one was a CEO or CFO for a big company, and nobody could see mom. The daughter had moved in with mom to be her caregiver, and nobody could see mom unless she allowed it. She wouldn't let them video chat with mom. She wouldn't let them care. And this is way before COVID. And so we thought we solved the situation. I give you authority. She was POA. She was using the financial POA to blow through mom's money. Mom had like $3.5 million in the bank. And she's paying caregivers to come in the home repeatedly for mom, 2 at a time, to help her care for mom, and she's going to care for mom. She's arguing with the doctors that mom does not have dementia. The doctor would write a prescription for mom to have some medication or something, and she would write a different prescription because she was a medical doctor. She knew more. Long story short, I'm at training on a Friday afternoon, and I get a phone call. My mom is saying, help me. She's completely bedbound now. I said, so call the police and have them go and help your mom. If she wants to go to the hospital, take her to the hospital. So finally, after about a half an hour on the phone, I convinced the police officer that if she could say, help me, she only has a POA. You need to go take her to the hospital because she wants to go. So in long story short, mom got put into hospice and the family got all reconnected. But we literally had to block the daughter, who was a medical doctor and had already blew through about $700,000 of mom's money because she had mom had caregivers in the hospital with mom to report who was visiting mom. Let's see. So what is the intersection between elder abuse, domestic violence, and sexual assault? There's this little section here where they all kind of connect. The National Clearinghouse on Abuse in Later Life describes abuse in later life as an intersection between elder abuse, domestic violence, and sexual assault. There's a direct correlation because what is abuse? Abusive relations are all about power and control. They look at that physical violence and sexual, which is all on the outer rim of this, that psychological abuse and emotional abuse that does our little cross section. How many times are they targeting the vulnerability and neglecting them? What about denying people access to spiritual and traditional events? About 2 out of 10 cases that I interact with, which to me is significant because people don't usually talk about spiritual traditions or events, but people say, I just want to go back to church. And how sad is that we can deny that or use the grandchildren or other kids against them, ridiculing them for their beliefs and physical and communication, isolating them. What power of attorney have you ever seen that says, I give my power of attorney permission to deny access to all the rest of my children or grandchildren or other family members? Okay, it just isn't in there. I haven't seen one yet. Abuse in later life can happen to older adults from all communities, racial and ethnic groups, and all economic levels. Abuse occurs across all genders and sexual orientations, and it can happen in private dwellings, facility settings, or in the public. I often say at MCO training that I do regularly to the staff, how many of you ever want somebody to tell you how you're going to live your life, who's going to care for you, and where you're going to live? And no one ever raises their hand. But yet most of the cases that come across our desk, somebody's telling our adult at risk or elder how they're going to live their life, where they're going to live, and only giving them limited options. What do they really want? Can we help them live their life to the fullest? Different forms of abuse can co-occur. Sometimes most of the time we have that financial abuse occurring with something else because someone in the house is using the money for something that it's not supposed to be used for. Sometimes it's diverting it. Sometimes, like my lady from the church, she's like, I'm telling you, I'm voluntarily giving this up. Well, you're voluntarily giving it up as a loan, and this lady has no intention of paying you back. That's a form of manipulation. Abuse in later life is often violence against women. The majority of older victims are female. About a third of older victims are male. A significant portion of abuse in later life, spouses or intimate partner people in the house that are controlling the situation or the relationship. Some additional signs of abusive caregivers include having a history of mental illness, substance abuse, family violence, or criminal behavior, failing to show affection toward the older person. How many times have you been in a home and somebody said, well, you're lucky I'm here to care for you? That's emotional abuse. Or you're lucky I'm here and you're not in a home. Being indifferent, angry, or aggressive towards that person and keeping that elderly person isolated is huge. That adds to or diminishes their self-esteem or ability to make decisions for themselves. Clients over the age of 60, abuser profile. 95% of the people in the age group of over 60 are someone that is in a position of trust to the elder. Almost half are adult children, about 17% are other close relatives, 14% are spouses and partners, only about 5% are other professionals and not really related to that individual. And that's huge. Why is that huge? Because it's always the person that you don't think it is. Some physical signs, physical abuse warning signs include unexplained or bone breaks, welts, bruises, cuts, open sores or wounds, and burns on the elder. In the past, like 3 or 4 months, we've literally had like 4 cases called in that said, this person came to the hospital and they have open sores and wounds all over, and they're supposed to have a caregiver. That's a criminal act. That's neglect. We need to include the police in the investigation. We need to make sure that this person has some way to get the care and support that they need. Identify what is the barrier to getting that care. Sometimes it's just that they don't want additional people in the house, but is it their decision, or is it the caregiver's decision, or the person living with them? Some emotional abuse warning signs include the elder is withdrawn and fails to participate in discussions or care planning or seeing other family members, usual activities. COVID threw everybody for a loop. Nobody could go anywhere. Those elders who were thriving and going to senior centers and dancing the night away and socializing with their friends and going to shopping and doing whatever they were doing, that stopped in a heartbeat for everybody, right? And our elders are now more cautious about going out, but they're also more withdrawn and failing to participate or wanting to go back. Sometimes that's influenced by some emotional abuse. The caregiver will often isolate the elderly person and won't let them be alone with other not giving me my medications to the elderly person, and they may be controlling, but not want to actively care for that elder. So is it emotional abuse or is it physical abuse or neglect? Some behavioral signs include depressive symptoms, isolating or withdrawing from others, and suffering from that, being ambivalent, unresponsive, or resigned. And some sexual abuse warning signs include unexplained sexually transmitted diseases. Now, how often is sexual abuse identified when an elder goes into the emergency department? That's a whole nother level of education and training that we need to focus on or put some more resources into, because sometimes it's not identified early enough. But having an unexplained sexually transmitted disease, bruising on the thighs or external genitals, or additional I lost my train of thought. Sorry, guys. Bleeding, pain, or irritation of the genitals, and engaging in unusual or aggressive behavior. Sometimes our folks with dementia who've been victims of sexual abuse will act out in different ways. Sometimes that's acting out to other residents or passing that on. It doesn't mean that it doesn't need to be identified and treated. It is also a criminal act. If they don't have the capacity to consent to sexual abuse or to sexual interaction, then they need to have a criminal referral sent in to law enforcement to investigate. Now, does this happen frequently? I think it happens way more than we know about. I think it's one of the most underreported areas in APS. I kind of pay attention to this because in Milwaukee, we have an enhanced multidisciplinary team grant where we have to do federal reporting on all of the different types of our abuse that comes into us. And it's very interesting to me how underreported, or how you hear on the backside that someone is potentially a victim of sexual abuse. So the report comes in for something else, and then that might come up that there was some other signs of sexual abuse? Well, physical condition. So even in our younger folks, if someone who is sexually assaulted or is being sexually abused, they will typically decrease their personal hygiene or be more withdrawn. Sometimes signs of physical abuse can be being malnourished when it's not due directly to an illness, having that poor hygiene or untreated bed sores, unexplained injuries, sunken cheeks or eyes with evidence of poor circulation, and having the caregiver give the wrong type and the wrong amount of medication. So medication is another type of ways that our older adults are typically abused, withdrawing or withholding it because we don't have the money to go get the medications, okay? Which also falls into our financial exploitation. So in misusing that power of attorney, personally, I love every time a person has a financial power of attorney and it's a financial exploitation case, because that's a fiduciary contract and they can be held accountable to that fiduciary contract. Now, what about the people who say, I'm the financial power of attorney and takes over everything and doesn't actually have a document? That's a different issue because then it's hard to prove where that money went and what's the trail of the money. Are they using their ATM cards without their consent? Oftentimes, I've noticed that we get a lot of referrals when people go in and out of programs like our publicly funded long-term care, or they're going in and out of IMT beds. And they're like, well, they're homeless now. They're living on the street or they're whatever. And I said, did anybody ask them where their money is? I once worked on a case for 18 months, and 18 months I kept getting referrals. We kept evaluating this person, and she's completely mentally ill, and we couldn't help her because she was untreated. And so she's completely, the complaint kept coming in. Well, she's getting cigarette butts out of the ashtray. Nobody said that she didn't have access to her money. Some friend of hers was coming over, had taken her ATM card or her Direct Express card and was getting all her money for months, and nobody knew she didn't have any money. So now my first question is, did they have access to their money? So, simple questions. Well, if they're lacking access to their money, then they're not going to be able to make good decisions about paying their rent. So we're evicting somebody because they haven't had access to their money for 9 months. So who's misusing or mismanaging their funds? Oftentimes it's somebody that's close. By deceiving or enticing the individual, or by forcing, compelling, or coercing the individual to give, sell it less than fair market value, or in other ways convey money or property against his or her will without his or her informed consent. So that's important because remember I told you the story gave it to this person's offspring. She even individual. It's a very loose statute that defines this, and we have a lot of power in APS to make a difference, but we have to work collaboratively with our community partners, the police and sheriff's departments, to make sure that we can get justice for the individuals who are milked out of their money based on financial exploitation. Some additional warning signs for this is canceled checks or bank statements no longer coming to the person's address, bouncing checks, ATM withdrawals, or online banking. 12 to 24 months before the person became, who keeps a detailed account of their personal value? We had a case in Milwaukee, and she had money over her house, which she had inherited from her parents. And she was a teacher her whole entire life. And her parents were teachers. The house was paid off when she got it. And then, so she had money hidden all around the house. What else she did, though, was she detailed in pieces of paper around her house every single valuable item she had, including all of her cashmere sweaters, how much they costed her the last time she got them cleaned, what they were worth. It was amazing when we got to go to court, because we were able to get her some justice. But that's not something that anybody takes the time to detail, is those personal valuable items, and you'll never know if they're actually missing. Does the person have new relationships online or in person? We're dealing with a guy right now who has a significant history of alcohol and other drugs in his lifetime, but he had a house paid off. He went on the honor flight. He met some woman on the honor flight and who was proceeded to milk him out of all of his money, get a reverse mortgage on his house, and dissolve his 50+ year marriage. He literally bankrupted the family by this personal relationship online from someone he met on the honor flight. Their care is substandard. Somebody doesn't want to pay for the care that they need, or is paying too much for the care that they need. The person does not understand their financial situation. Are they able to comprehend that their goals to remain in their home, live in their home, and the cost of living in their home is going to be significantly diminished if they keep giving the money away that they're giving away? Are they withdrawn? I will find out everything you. Are they hoarding of abuse? Did I totally beep out on you guys as talking along? And all right, turn off my video to see if it helps you guys. There are many concerns. Oh, did you guys hear that? Should I repeat it? Oh, I gotta share my screen again. Okay, hold on. Okay, sorry, everybody. Other safety concerns include the changes in behavior, withdrawn or isolated from family and friends, a new involved group or person, new spending patterns, unsanitary conditions in the home, hoarding, a person with memory issues, and isolation in the community. Oftentimes it's the neighbors or family members or the person at the bank or the grocery store who notices a change in someone that they've routinely seen has been able to handle most of their life and care. Who are mandated reporters in Wisconsin? Wisconsin is considered a limiting reporting rules, okay, under 4690 for anybody age 60 and above, under 55.01 for 18 to 59. If an elder or adult at risk is being seen in the course of a person's professional duties and the professional is licensed, regulated, or working in a licensed, regulated entity, then they must report, okay? If the person has made a request for the report, or there's a reasonable cause to believe that they're at imminent risk and is unable to make an informed judgment about reporting, or other adults at risk are also at imminent risk. So I say all the time about reporting, you're civilly and criminally protected from reporting in good faith. Why wouldn't you report and get somebody help? Oftentimes, APS is the intervention that helps people stay in their home, that helps people get on the right track, that connects them to supports and services that will keep them independent in the community. Because our whole goal is about intervention. If you see something, say something. Anyone can report. You don't need to be sure that that abuse is occurring. You do not need to have all the details. You can remain anonymous. And the statutes provide for that civil and criminal protection. However, don't forget that the police have a role. I can't say it enough that APS is an intervention. We also need to start holding people accountable legally for all of the stuff that they're doing to our adults at risk and elders. For example, that neglect, that financial exploitation, that abuse. We need to be sure that people are getting assistance with those criminal complaints also, so that we can get resolution. Maybe if some of these are written up in the news enough, because the police investigation is public information, then maybe people will think twice about their targeting adults and elders at risk. There are many agencies available to help. Again, the Elder Abuse Statewide Line, the National Elder Care Locator, local law enforcement. Don't forget about your local attorneys. They have a lot of information and can help with elder law. Don't forget about our friends at Senior Law. They take on cases to help. And don't forget to work with Adult Protective Services. Do that report. Oftentimes, if we can get in there early, we can do an intervention or make suggestions that help that person stay independent, stop the bleeding from the financial and exploitation. My friend Lori made this slide at in Waukesha, so I have to give her credit for some of her slides here. But APS is an integral part of the response to abuse, neglect, and financial exploitation. But we also have these other community partners, our law enforcement, our private attorneys, our protective services is APS, and Adult Protective Services, because sometimes we put home care in. Sometimes we encourage people to enroll in our managed care organizations so they have additional eyes and ears in the home and support to help them make decisions or help them with the increased care and services that they need. Adult Protective Services values. Adult Protective Services is the premise that all adults have a right to be safe, but they retain their civil and constitutional rights unless the societal norms, as long as those decisions do not harm other people. I'm sorry, you guys, I keep getting my internet isn't stable. I don't know why that happens. Adults have a right to accept or refuse services. We can't force them to take services. What we can do is suggest that they might be safer. They might have additional support. They might be able to realize that they can stay in their homes longer with additional care and support. As is the case with any adult, victims have a right to decline protective services unless a qualified professional determines that they're unable to make decisions for themselves. In these cases, APS may need to petition the legal system to appoint a guardian or conservator. But we take that very seriously in APS. We don't want to be the county in somebody else's business. I often talk about the fact that I'm the 55 coordinator and the only technically 55 coordinator in the state that is supposed to do emergency protective placements, right? But the reality is I spend 90% of my time avoiding doing an emergency protective placement. I staff cases, I work with people. I literally have gone in on a case where Friday afternoon, I get 5 calls, okay? He won't go to the hospital to get checked out, blah, blah, blah. Finally, after the 5th call, and me telling them, tell them to get in the ambulance and go get checked out, I go over to the house and I say, Mr. Jones, did you fall every day this week? He says, yeah. He said, yes. I said, do you think that's okay? He says, well, I don't know. I said, get in the ambulance. I was literally in his house 5 minutes, told him to get in the ambulance. He went to the hospital. What's wrong with that? Did I give that guy a choice? I can't see any of your responses, but in any event, think about that, because think about the fact that people sometimes want us as people in positions of authority to help them make the right decision. Sometimes it's giving them less choices, but it's still important that we give them choices. I simply said to him after he got in the ambulance, I promise you, I'll get you back home. You go voluntarily, you get to come home whenever you want, and we'll take care of your wife for you. We did. He got evaluated. He needed to have his blood pressure medication tweaked so he quit falling. He went back home within a couple days and services resumed in his home. Services overview. This again is my friend on here. Referral, investigate what's in the protective services will help this person. Will they voluntarily do these protective services like managed care organizations, our independent IRIS consultants, pay privately for services? Can we hook them up with case management services, even if they have significant assets? If not, do we need to petition the court for protective placement or services? Some of the tools that we use are the statutes for investigation, those protective services, court orders for decision makers, but the limitation again is self-determination. They have a right to refuse. They have a right to say, get out of my house. I don't want anything to do with you. Now, what happens when the person lacks capacity or appears to lack capacity? Then we have to try to figure out how to do those better assessments and get better assessments from a doctor in order to do anything like petitioning for protective placement or petitioning for guardianship, because you cannot have an emergency protective placement or a protective placement on someone when someone doesn't actually need a guardian. Protective services, again, are in-home caregiving, alternate decision makers. Do they have a power of attorney? If they have a power of attorney, is that document sufficient? Is that person willing to help them? Is that person committed to understanding their role and choices? And are they supporting that person's right to adult self-determination? They have a right to make bad choices about their lives. They can refuse services. They can refuse interventions. They can refuse medical care. They don't have to take mental health medications. APS must respect a decisional person's right to self-determination. If there are concerns about decision-making capacity, APS can petition the court for additional protective services. Protection for people who are legally incompetent. Again, civil court remedies for protection include that guardianship, protective placements, protective services order, court reviews of those decision makers, vulnerable adult restraining orders. But incompetence is a legal term. We can't determine someone's incompetence. A doctor or a psychologist must do a report and indicate why that person lacks capacity and that condition is permanent. In our areas of mental illness, we need to have a doctor say, even with treatment, even with the treatment and medication, this person cannot or lacks the capacity to understand the ramifications of their decisions. Our role is really to look at those interventions, to complete an investigation and gather the facts, to make sure that there's an intervention, a safe plan, to see if we can aid our other community partners in creating a safe plan for the person. We want to always try to advocate for that person. What does that person want? What is important to that person? I often ask in staffings, well, what did your client want? And every single time, nobody could tell me. But yet, we want to make sure that this person receives a placement in a facility. Well, reality is a facility isn't for everybody. Some people can do well with supports in their homes, but do we need to sometimes maybe have a protective services order, a protective placement order to ensure that they accept the services? Sometimes, but we want to try all the least restrictive options first, because APS is about the intervention. So what are the signs? It's on everyone to stop elder abuse. If you see something, say something. Decisions about an older person's life are not always in their best interest. That's one of the signs. Sudden changes in behavior. Are they more withdrawn? Are they isolated? Are they not able to see family members? Are they isolated from their grandchildren and children? Are they estranged from their grandchildren and children? Unusual changes in their spending or money management. Are they giving away $160,000 because a church friend said she needed it to help her husband? Do they have unexplained physical injuries? And do they have unexplained sexually transmitted diseases? Are they living in unsafe or unsanitary conditions? Some initiatives in Milwaukee County include, for our adults at risk and our elders, is we have a very robust I-team. We have times a minimum a year financial that NCAL grant training, abuse and later life grant. NCAL. We also were successful in writing an enhanced multidisciplinary team grant where we staff individual cases similarly to what Dane County is doing in that crisis debriefing. So we staff cases that touch multiple systems in our community under our enhanced multidisciplinary team and try to come together as a community to promote better options for the adult at risk or elder that we serve. And then it's still called our Milwaukee County Department on Aging website, but that's soon to change. That website is under construction sort of to be one more inclusive aging and disability services website. And hopefully by early next year, that'll be one complete website. Again, some options to report in Milwaukee County include our online, our aging phone number. We have one phone number now. You don't have to call the 289-6660. That number is still active, but we have the 414-289-6874 is now our main line for reporting. Some additional resources for you are all of these websites. Don't forget about our friends at GWAR, the Greater Wisconsin Agency on Aging. They have fabulous resources on a role of a power of attorney, guardianship, decision-making, including substitute decision-making, including forms and helpful resources, our National Adult Protective Services website, and then some additional consumer protection. The Consumer Financial Bureau has some additional wonderful resources on stopping financial exploitation of elders. The Abuse in Later Life, National Clearinghouse on Abuse in Later Life has a ton of resources. The National Adult Protective Services Technical Assistance Center, which I don't have on here, but if you do Technical Assistance Center, Adult Protective Services, you get them. And then all of our counties and across the country participate in what's called World Elder Abuse Awareness Day. That is a national initiative by our friends at the ACL. And they look at promoting elder abuse awareness on June 15th every year. And so your local communities and others will put on different events. Typically, Milwaukee County will do a big training or some other events and have something at, last year we had something at our senior center where we had a lot of community partners come out and give out goodies and talk about it, and our county exec does proclamation, and we put up our purple pinwheels for how many cases we investigate each year. So we have kind of a sea of purple because Milwaukee County investigates about 3,000 cases a year. So that's all I have for you guys. Do you have any questions, comments, or concerns?
Thank you very much, Dinah. Really appreciate it. Terrific presentation. Why don't you unshare your screen if you would real quick, and let's try the video for a couple of minutes if we can. I had a question. If anyone out there has a question, please enter it in the Q&A box so we can get that to Dinah. But I'm wondering, what if you have a situation where, say an older adult is living with a child, and this kid isn't beating the older adult, but it's like inflicting mental abuse on the person. They're constantly sarcastic, belittling. How do you deal with a person like that, where they're just not, they're just nasty, making life, you figure, well, they could live perfectly well in their own home if this kid was gone. How do you deal with that? Your audio's off right now. Unmute yourself. Yeah. How do you deal with that?
Sorry, I had to cough, so I didn't want to cough on you guys.
Okay. Sorry about that.
Well, that gets tricky. Sometimes and one of the things that Milwaukee is really working hard to do is involve our community partners. So we know that is going on, and we're getting multiple reports. If the older adult or adult at risk does not want to leave, we will try to work with them for a long time. If they lack capacity, we will move them or move that person out, or consider whether a vulnerable adult restraining order is appropriate. Now, it still gets tricky even if we get all that stuff. I have a case right now where the family member went so far as to get a vulnerable adult restraining order for the person, and the individual who's financially exploiting her is still coming back and getting money, even with a vulnerable adult restraining order. So unless the person who has the restraining order against the person will understand that they need to call the police when the person is doing this, it gets very tricky, because it's when it's that family member relationship, most of the time they have been helping that family member forever, and they don't understand why their child is doing this or why their niece or nephew is doing that to them. And so it's work in progress to get them safe. Sometimes it takes many reports over time for us to actually be able to act.
Sure. Do you have enough personnel in your office to handle all of these cases? We were talking, I think, before the session started about the budgetary difficulties, at the county and local level. What kind of shortages do you find, if any, or you have everything you need?
Oh, never. Elder abuse and adult protective services is the most underfunded program in the country, if you ask me. There's just not enough resources. While we have this arbitrary power to do something, reality is that the statute says one thing, and what we're able actually to do is always a different thing. And again, if we don't constantly work with our community partners like law enforcement to get that criminal aspect of this taken care of, I don't know that we'll ever be able to move that needle forward. Lori and I attended a elder abuse conference in put on by Dr. Moscata in February of this year out in California.
There's that video thing again.
It was very research-based and focusing on changes in the guardianship, supportive of people monitor guardianships. But if we don't put the money where they have to monitor the stuff, for example, our probate, who monitors guardians of the estates and those financial things, how do we know what our corporate guardians are doing? How do we know what our family member guardianships are doing? So we have to, I think we need to really think through that process, similarly like our dementia crisis work groups are doing in our state dementia plan. We also need to have some sort of steering committee around these issues with APS that really look at what are the problems that how do we monitor the stuff that's going on? What are the potential complications when something has changed?
Yeah, I got a nice comment from Beth Freeman at who presented
She
earlier.
could probably add better than me.
Probably, but she says APS is not found at the level it needs to be to meet needs in an expanding aging population. We in Dane County keep advocating for further support and resources in our area. Do you think, I mean, what do you do to try and educate legislators, county commissioners, local aldermen? I mean, where, they seem to have money. I mean, this is my political comment, right? But you look at it and you wonder if the priorities are established properly so that, the vulnerable are taken care of.
Every time they send us a case to investigate and tell us we need to have a result, we need to say, no, I'm just kidding. I truly, it's a lot of this education and having them involved in, when it comes time to understanding what a budget cut to APS means, how that means even one person, if one vulnerable adult or elder slips through the cracks because we have budget cuts, how devastating is that? I mean, when you're talking about $2.9 billion annually that's lost financially, couldn't we put that money to better use if we can stop it?
Yeah, exactly.
That's a big answer, sorry.
Any other questions out there? Please enter it in the Q&A. Otherwise, I see it's noon. If I don't get a question here in a second, we're going to give Dinah her lunch break back. Okay.
Thank you guys for having me. I hope I didn't rehash the whole APS thing for the most of you. I appreciate being given the opportunity to be here and meet with you guys.
We appreciate you taking the time and offering us your expertise. So the terrific presentation. Thank you. Thank you so much. Okay, and thank you, everyone. Remember, I'll be sending you a survey next week. Please take a couple minutes to send us your feedback.